Question 1. A nurse is triaging for clients in the emergency department. Which client with suspected influenza should the nurse see first? A 24-year-old with a fever of 100.2 degrees Fahrenheit and muscle aches. B. A 70-year-old with confusion and shortness of breath. C. A 40-year-old with nasal congestion and fatigue. D. A 16-year-old with a dry cough and sore throat. Answer. B. A 70-year-old with confusion and shortness of breath. Question 2. A nurse is planning care for a patient with confirmed influenza. Which task is appropriate to delegate to the unlicensed assistive personnel, UAP? A. Administering oseltamivir. B. Teaching hand hygiene to the patient. C. Assisting with oral fluids and monitoring intake. D. Assessing for respiratory distress. Answer. C. Assisting with oral fluids and monitoring intake. Question 3. Which intervention has the highest priority in preventing hospital-acquired influenza transmission? A. Administering antibiotics to all exposed patients. B. Performing hand hygiene before and after patient contact. C. Keeping doors to all patient rooms closed. D. Encouraging high-protein diets. Answer. B. Performing hand hygiene before and after patient contact. Question 4. A patient with influenza is placed in a semi-private room. Which patient should not share the room with this client? A. A patient with a sprained ankle. B. A patient recovering from a total hip replacement. C. A patient with neutropenia after chemotherapy. D. A patient scheduled for discharge. Answer. C. A patient with neutropenia after chemotherapy. Question 5. A nurse is reviewing discharge teaching for a client with influenza. Which statement by the client requires further teaching? A. I will stay home from work until my fever is gone for at least 24 hours. B. I can return to the gym tomorrow if I feel better. C. I will continue to drink plenty of fluids. D. I'll cover my mouth when I cough. Answer. B. I can return to the gym tomorrow if I feel better. Question 6. A patient asks why they need a flu vaccine every year. Which explanation should the nurse provide? A. The vaccine provides permanent immunity. B. It prevents all respiratory infections. C. Flu viruses change each year, requiring a new vaccine. D. It protects against bacterial infections. Answer. C. Flu viruses change each year, requiring a new vaccine. Question 7. A nurse is caring for an elderly client with influenza. Which of the following findings requires immediate intervention? A. Low-grade fever and fatigue. B. Productive cough with clear sputum. C. Crackles in lung bases and increasing shortness of breath. D. Decreased appetite and malaise. Answer. C. Crackles in lung bases and increasing shortness of breath. Question 8. The nurse is assigning patients during a flu outbreak. Which client should be assigned to the most experienced nurse? A. A 50-year-old with a mild cough and fatigue. B. A 30-year-old with sinus congestion and sore throat. C. A 76-year-old with COPD and fever of 101.5 degrees Fahrenheit. D. A 42-year-old with muscle aches and runny nose. Answer. C. A 76-year-old with COPD and fever of 101.5 degrees Fahrenheit. Question 9. Which action should the nurse take first when a patient with influenza shows signs of respiratory distress? A. Notify the healthcare provider. B. Apply oxygen per nasal cannula. C. Increase fluid intake. D. Reassess in 30 minutes. Answer. B. Apply oxygen per nasal cannula. Question 10. Which of the following statements made by a new nurse regarding flu vaccination indicates the need for further education? A. I should receive a flu vaccine every year. B. The vaccine can reduce the severity of illness even if I get the flu. C. I don't need the vaccine because I'm healthy and under 25. D. The flu vaccine helps protect my patients. Answer: C. I don't need the vaccine because I'm healthy and under 25. Question 11. A nurse is teaching a group about influenza prevention. Which strategy is most effective in reducing the spread of influenza in a community setting? A. Avoiding dairy during flu season. B. Encouraging annual flu vaccinations. C. Taking antibiotics when exposed. D. Wearing N95 masks in public. Answer: B. Encouraging annual flu vaccinations. Question 12. A patient hospitalized with influenza asks for something to relieve body aches. Which order should the nurse clarify before administering? A. Acetaminophen 650 milligrams orally every 6 hours. B. Ibuprofen 400 milligrams orally every 8 hours. C. Aspirin 325 milligrams orally every 4 hours. D. Warm compresses for muscle pain. Answer: C. Aspirin 325 milligrams orally every 4 hours. Question 13. Which task is appropriate for the nurse to delegate to a UAP caring for a patient with influenza? A. Suctioning the patient's airway. B. Evaluating respiratory effort. C. Measuring and recording vital signs. D. Teaching droplet precautions. Answer: C. Measuring and recording vital signs. Question 14. A nurse is caring for a child with influenza who is febrile and irritable. What is the nurse's priority intervention? A. Administer a warm blanket. B. Offer cold fluids and acetaminophen. C. Begin chest physiotherapy. D. Start 4 fluids. Answer: B. Offer cold fluids and acetaminophen. Question 15. A nurse is precepting a new graduate nurse who is caring for a patient with influenza. Which action by the graduate requires immediate correction? A. Wearing a surgical mask during care. B. Encouraging fluid intake. C. Using alcohol-based hand sanitizer. D. Taking the stethoscope into the next patient's room. Answer: D. Taking the stethoscope into the next patient's room. Question 16. Which influenza-related task must the RN perform and not delegate to a licensed practical nurse, LPN? A. Administering oral oseltamivir. B. Reinforcing droplet precaution education. C. Evaluating a patient's response to treatment. D. Assisting with sputum collection. Answer: C. Evaluating a patient's response to treatment. Question 17. During flu season, which of the following patients is at highest risk for complications from influenza? A. A 30-year-old school teacher. B. A 65-year-old with heart failure. C. A 40-year-old athlete. D. A 28-year-old with no chronic illness. Answer: B. A 65-year-old with heart failure. Question 18. The nurse is teaching infection control to a patient with influenza. Which statement indicates a need for further teaching? A. I will wash my hands frequently. B. I'll wear a mask if I leave my room. C. My family can visit without masks if they're healthy. D. I will avoid sharing utensils. Answer: C. My family can visit without masks if they're healthy. Question 19. Which nursing intervention is most appropriate to reduce the risk of pneumonia in a client with influenza? A. Encourage coughing and deep breathing exercises. B. Restrict fluids to prevent aspiration. C. Apply warm compresses to the chest. D. Administer cough suppressants regularly. Answer: A. Encourage coughing and deep breathing exercises. Question 20. A patient with flu-like symptoms is being discharged. Which instruction should the nurse prioritize? A. Return if symptoms last more than 2 days. B. Limit contact with others until fever-free for 24 hours. C. Discontinue antivirals if you feel better. D. You can return to work with a mild cough. Answer B. Limit contact with others until fever-free for 24 hours. Question 21. A nurse is evaluating a pediatric patient with flu symptoms. Which finding requires immediate provider notification? A. Temperature of 102 degrees Fahrenheit. B. Mild irritability and poor appetite. C. Retractions and nasal flaring. D. Sneezing and rhinorrhea. Answer C. Retractions and nasal flaring. Question 22. A client is prescribed oseltamivir for suspected influenza. What should the nurse include in the medication teaching? A. This medication should be taken on an empty stomach. B. You should start this medication within 48 hours of symptoms. C. This drug is only effective if your fever is below 100 degrees Fahrenheit. D. Take this medication only when symptoms worsen. Answer B. You should start this medication within 48 hours of symptoms. Question 23. During a community flu outbreak, which nursing action is most appropriate in a long-term care facility? A. Cancel all physical therapy sessions. B. Enforce droplet precautions for symptomatic residents. C. Provide antibiotics to all residents. D. Isolate all vaccinated residents. Answer B. Enforce droplet precautions for symptomatic residents. Question 24. Which client is most appropriate to assign to a nurse floating from postpartum care during a flu outbreak? A. A patient on high-flow oxygen with flu-induced pneumonia. B. A newly admitted influenza patient with confusion. C. A stable patient recovering from influenza on oral antivirals. D. A client requiring frequent suctioning and nebulizers. Answer C. A stable patient recovering from influenza on oral antivirals. Question 25. A nurse cares for a patient with influenza who is vomiting and has diarrhea. What is the priority nursing diagnosis? A. Risk for aspiration. B. Imbalanced nutrition, more than body requirements. C. Fluid volume deficit. D. Risk for impaired skin integrity. Answer C. Fluid volume deficit. Question 26. A parent asks why their child can't get the nasal spray flu vaccine. The nurse should respond with which explanation? A. It contains aluminum, which is not safe for children. B. Your child has asthma, and this form isn't recommended. C. Children under age 12 should only receive injections. D. This version is only for adults over 60. Answer B. Your child has asthma, and this form isn't recommended. Question 27. Which of the following interventions should the nurse implement for a patient hospitalized with influenza? A. Encourage visitors to remove masks during visits. B. Administer antibiotics as ordered. C. Place the client on droplet precautions. D. Provide high-calorie meals to prevent weight loss. Answer C. Place the client on droplet precautions. Question 28. The nurse is reviewing vaccination records. Who is most in need of receiving the influenza vaccine today? A 26-year-old nursing student starting clinicals tomorrow. B. A 33-year-old with a runny nose and sore throat. C. A 45-year-old who had a recent minor surgical procedure. D. A 60-year-old who received a shingles vaccine yesterday. Answer A 26-year-old nursing student starting clinicals tomorrow. Question 29. A patient receiving care for influenza is scheduled for nebulizer therapy. What instruction should the nurse give to the UAP assisting in the room? A. Check the patient's oxygen saturation before and after. B. Clean the nebulizer chamber thoroughly. C. Call me if the patient starts coughing. D. Ensure the patient wears a mask during therapy. Answer B. Clean the nebulizer chamber thoroughly. Question 30. Which action by a nurse best protects immunocompromised patients during flu season? A. Assigning them to rooms near nurse stations. B. Providing vitamin C supplements. C. Requiring all visitors to wear surgical masks. D. Ensuring staff are vaccinated and screened for symptoms. Answer D. Ensuring staff are vaccinated and screened for symptoms. Question 31. A school nurse is educating children about flu prevention. Which strategy should be emphasized? A. Drinking at least 3 liters of water a day. B. Staying indoors during flu season. C. Frequent hand washing and covering coughs. D. Using handkerchiefs instead of tissues. Answer C. Frequent hand washing and covering coughs. Question 32. A nurse caring for a flu-positive client notes a sudden drop in blood pressure and increased respiratory rate. What is the priority action? A. Recheck vital signs in 15 minutes. B. Increase oral fluid intake. C. Call the rapid response team. D. Administer for acetaminophen. Answer C. Call the rapid response team. Question 33. Which statement by the client receiving the flu vaccine indicates understanding of side effects? A. I might have a mild fever or soreness at the injection site. B. I'll probably get the flu from this shot. C. This vaccine protects me for at least 5 years. D. I shouldn't get the vaccine again if I get a headache. Answer A. I might have a mild fever or soreness at the injection site. Question 34. During an outbreak, which patient is the highest priority to monitor for complications from influenza? A. A pregnant woman at 32 weeks gestation. B. A 25-year-old with controlled hypertension. C. A 12-year-old with a sore throat and runny nose. D. A 36-year-old marathon runner. Answer A. A pregnant woman at 32 weeks gestation. Question 35. A nurse is teaching a family about home isolation for a child with influenza. Which statement requires follow-up? A. We will keep our child in a separate room if possible. B. We will give aspirin if the fever continues. C. We'll encourage plenty of rest and fluids. D. We will notify the doctor if breathing becomes difficult. Answer B. We will give aspirin if the fever continues. Question 36. A nurse provides education on the flu to a patient with a heart transplant. Which statement requires clarification? A. I should get the flu shot every year. B. Live flu vaccines are not safe for me. C. If exposed, I should notify my provider right away. D. I can wait until symptoms appear before doing anything. Answer D. I can wait until symptoms appear before doing anything. Question 37. A client reports taking leftover oseltamivir from last year. What should the nurse do first? A. Encourage completing the remaining doses. B. Notify the provider and obtain a new prescription. C. Reassure the client that reuse is safe. D. Document the report in the chart. Answer B. Notify the provider and obtain a new prescription. Question 38. Which dietary recommendation is most appropriate for a patient recovering from influenza? A. High protein and low carb meals. B. Clear liquids and bland foods. C. High fiber diet with dairy. D. Ketogenic meal plan. Answer B. Clear liquids and bland foods. Question 39. A nurse observes a visitor coughing while visiting a flu patient. What is the best immediate action? A. Offer the visitor a surgical mask. B. Ask the visitor to leave the room. C. Call hospital security. D. Close the door and notify infection control. Answer A. Offer the visitor a surgical mask. Question 40. Which staff member is safe to care for a hospitalized client with influenza? A. A pregnant nurse in her 3rd trimester. B. A nurse who had the flu vaccine 3 weeks ago. C. A nurse currently coughing and febrile. D. A float nurse with no mask access. Answer: B. A nurse who had the flu vaccine 3 weeks ago. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!